My name is Jacqueline. I am 32 years old and from the Yurok tribe in Northern California. I graduated from Sacramento City College with an associate's degree in dental hygiene. I've been employed at the United Indian Health Services in Arcata as a dental hygienist for the past 6 years.
My name is Ricky O'Shea. I'm a 34-year-old atheist Irish American man. I received my degree in civil transportation engineering from Arizona State University. I currently work for Caltrans as a civil transportation engineer.
Ricky and Jacqueline met in 2007 through mutual friends. 3 years later, they were married on June 12, 2010, when they were 26 and 28 years old, respectively. They now live in a comfortable, middle-class lifestyle with a 3-bedroom home in a desirable neighborhood in Arcata, California. On April 14th, 2013, their daughter Zaylee was born at St. Joseph's Hospital in Eureka, California. Here she is at about 5 months old, sitting up, and about 9 months she started crawling, and as she started to walk at about 12 months old. At 3.5 years old, she is thriving through peer interactions. At this point, she has met all developmental language milestones. Jacqueline and Ricky did not have any immediate problems within their relationship. They spent time together as a family as often as possible. Jacqueline and Ricky went on dates as often as childcare permitted, at least once a month. Neither Jacqueline nor Ricky felt like anything in their relationship needed to be changed. They had disagreements occasionally, like most couples, although nothing that was not resolved within a few hours. The disagreements were always on what appeared to be small stuff at the time. For example, on Zaylee's 3rd birthday, they threw a birthday party that consisted of family and close friends. Ricky was supposed to call and order a cake to be ready, but he became distracted and forgot. Jacqueline was out running errands before the party and went to pick it up from Ramon's bakery. When she arrived to pick up the cake, she was informed that the cake was not reserved under either of their names. When she called to ask Ricky about it, he got mad and said that she should have taken care of it and that it was her fault that they did not have a cake now. After the party, Ricky apologized about blaming her and said it was the stress of the party that made him stab at her. Jacqueline was angry that he had blamed her even though he committed to ordering the cake, but she accepted his apology and believed that it was the stress of the party. It was disagreements like that Jacqueline and Ricky had experienced, but always worked it out. Overall, Jacqueline and Ricky had a stable and committed marriage and life.
My name is Erica Solano. I am a 31-year-old preschool teacher. I studied at Humboldt State University where I received my bachelor's degree in child development. I have been teaching preschool for the last 6 years and am currently a preschool teacher at Little Learners in Arcata.
1 year ago, Jacqueline and Zaylee were driving to Zaylee's maternal grandmother's house in Willow Creek. It was November 19th, 2016. It was the first rain of the season and the roads were slick. Jacqueline was driving on SR 299 when she lost control of the vehicle at mile marker 34.5. This caused the vehicle to roll over several times down a steep embankment down the side of the road. The vehicle came to a complete stop on its roof, trapping Jacqueline and Zaylee inside. Jacqueline managed to climb out and flag down another car. The Willow Creek Fire Department, as well as the medical officials from CHP, arrived in 15 minutes and extracted Zaylee. Both Jacqueline and Zaylee were taken to Mad River Community Hospital by ambulance. Once Jacqueline and Zaylee reached the Mad River Hospital, Jacqueline received an X-ray finding a broken arm, and she received a cast, and Zaylee immediately received professional care as well. This included every effort to stabilize her and running tests to assess the injury to her head. They performed a CT scan and an MRI. Through those imaging tests, it was found that there was swelling in Zaylee's brain. Since Mad River Hospital does not have a pediatric unit, and the results of the imaging test were extensive, it was decided that an emergency flight to UCSF Children's Hospital was necessary. Once arrived at UCSF, medical professionals then performed a Glasgow coma scale to assess the initial severity by checking a person's ability to follow directions and move their eyes and limbs. Zaylee scored a low score of 5, putting her in a highly severe brain injury category. Medical professionals then decided to induce a coma in order to attempt to minimize the brain from swelling. While Zaylee was in a coma, medical professionals tended to severe abrasions around her body. 2 particularly large abrasions located on her right thigh and her mid-back required several stitches. It was also found that she had a small hairline fracture along her left humerus that required an arm sling for at least 4 weeks. While in the coma, her brain activity and intracranial pressure were monitored carefully by medical professionals. An intracranial pressure monitor was inserted in order to further help monitor the pressure. Once the intracranial pressure started reducing, additional computerized tomography scan and magnetic resonance imaging was done to further assess the swelling in her brain. After 7 days, the swelling had reduced significantly, and the doctors felt it was safe to take Zaylee out of a coma. Once Zaylee woke from the coma, it became apparent to medical professionals that Zaylee had an injury to the left side of her brain which could be affecting her speech. Another week was spent in the hospital while medical professionals continued to monitor Zaylee's brain. Once the swelling was reduced, Zaylee was evaluated by a speech pathologist in the hospital. The speech pathologist ran assessments of Zaylee's auditory comprehension, verbal expression, reading and writing, and functional communication. Once the assessments were finished and reviewed, the speech pathologist diagnosed Zaylee with expressive aphasia, a form of aphasia in which speech output is severely reduced and is limited to short utterances.
Older research states that children can have developmental aphasia, meaning that they can be born with this disorder. However, most new literature refers to childhood aphasia as an acquired impairment similar to adult aphasia. For the purposes of this video, I will be examining the causes, characteristics, and language implications for children with acquired aphasia. The most common cause of childhood aphasia is traumatic brain injury, or TBI. This occurs when the child's head is hit or shaken. Although TBI is the most common cause of aphasia in children, only about 19% of pediatric TBIs result in childhood aphasia. Strokes resulting in childhood aphasia can be caused by birth defects, infections, or blood disorders like sickle cell disease. Other causes of childhood aphasia include infectious diseases such as encephalitis or severe swelling of the brain, convulsive disorders such as Landau-Kleffner syndrome, or brain tumors, specifically on the left side of the brain. In the acute stages of brain injury resulting in aphasia, most children experience a brief period of mutism or silence. After this effect fades, a child affected by aphasia may have anomia or naming difficulties, problems with comprehending speech, and difficulty initiating or beginning to speak. They may also frequently exhibit semantic paraphasias such as saying the wrong word, phonemic paraphasias such as mixing up sounds in a word, dysarthria or imprecise speech, perseverations or repetitions of a familiar word or phrase, and difficulty with reading and writing. The symptoms of aphasia affect many aspects of language and communication in children. For one, most children with aphasia have non-fluent speech, meaning they struggle to get words out and speak in short phrases. They also often mix up words or sounds. Their inability to use full sentences with correct words greatly impacts communication with adults and peers because part of the message is lost. Children with aphasia also have trouble understanding what is said to them. Long-term language effects range from mild to severe, based on the size, location, and cause of damage to the brain. These persisting language problems may result in the child doing poorly in school or having difficulty socializing with peers. Children with TBI usually have the most full recovery in comparison with children who have aphasia due to Landau-Kleffner syndrome, stroke, or infectious disease. This is because damage from TBI is located in one single area of the brain as opposed to more widespread damage. Children's ability to regain language skills is greater than adults because they have greater neuroplasticity. This means that the functions of the brain are less set in stone because other parts of the brain can take on the responsibilities of the damaged areas. In children with aphasia, this means that other parts of the brain can learn the language functions.
According to the ABCX model, the stressor, A, was the car accident that occurred on November 19, 2016. The resources, B, they had at the time of the car accident were the parent's income, access to health insurance, and high-quality medical care and support from extended family on both Jacqueline's and Ricky's side. The perceptions, C, of the stressor were negative. The parents' emotions were sensitive. Ricky began blaming Jacqueline for the car accident. Jacqueline immediately felt relieved because Zaylee was alive, but then began feeling guilty over the car accident. The high stress of the car accident made this situation into a crisis. X.
My name is Xochitl Mesa. I'm 34 years old. I identify myself as a Mexican-American female. My home is in Los Angeles. I came to Humboldt State University to pursue a career in speech-language pathology. After graduating from Humboldt State University, I continued on my education to receive a master's degree at Michigan State University. I returned to live in Arcata at 30 years old. I applied to Humboldt County Office of Education for their local position as a speech-language pathologist.
Oh, Mama.
You say it.
Oh.
Say 1,
1,
2,
2,
3,
3,
4,
4,
5,
5,
6,
6,
7,
7,
8,
8,
9,
9,
10.
10.
Very good.
Following their separation, Jacqueline and Ricky shared joint custody of their daughter Zaylee. The child spends 1 week with her mother and 1 week with her dad, exchanging on Mondays after school. The extent of their co-parenting is limited to attending meetings and conferences regarding Zaylee and the occasional text messages. Jacqueline set a list of goals for herself. The first goal was for her to begin individual therapy. She felt that this would give her space to talk without judgment and in a supportive environment to explore her emotions and ways to help deal with the changes in her life. Secondly, she committed to joining an online support group for parents with children with exceptionalities. Her third goal was to practice some form of self-care. Ricky has been working on creating a set of goals to help himself with adapting to the events of the last 6 months. He has come up with 3 short-term goals to begin with. The first is to begin therapy. This is helping him figure out his emotions about everything that has happened in the last 6 months and working at coping with those emotions. The second goal is to be fully present in all of Zaylee's meetings with both the language pathologist and her preschool teacher. During those times, he will work at putting aside any emotions he has towards Jacqueline. The third goal is to find a set time each week where he will do an activity that will allow him to relax and be engaging enough to keep his mind occupied. For Zaylee, the goals that were discussed were, first, for her to develop her language further by practicing exercises given to her to help her express herself. Secondly, to go to every meeting with her speech-language pathologist and her preschool teacher. Lastly, her goal was to interact with other children around her age to continue on with Maslow's hierarchy of needs into love and belonging. After Jacqueline and Ricky both started individual therapy, Jacqueline requested to start couples therapy in order to work on their relationship. Ricky was hesitant to begin with, but has since agreed for the sake of their daughter, Zaylee. If couples therapy goes well for 2 months, it has been suggested by the therapist to schedule a weekly family dinner. This will help bring the family together outside of a clinical setting without a mediator. After sessions with Miss Miza and Solano and Zaylee's parents, Zaylee would be able to regain her language back and would be able to express herself into adulthood. Zaylee would be able to relearn language in a different manner. The neuroplasticity would help her regain her expressive language. Her brain will be able to learn different learning styles and use them in order to communicate.